In the previous video, we talked about some of the causes of joint pain, and now I want to talk about solutions. This is what we're really interested in, right? And I want to say, first of all, if you have some severe pain, you really need to consult a healthcare professional, maybe to have some x-rays or have some kind of a diagnosis around what's actually going on. And hopefully they will develop a personalized treatment plan for you. But if it's not real severe, there are a whole lot of things that we can do naturally to help support that joint pain. And so I want to talk about some of that. Physical therapy is really a great one, and it can improve your joint function and reduce pain through the targeted exercises and stretches. I'm a big believer in physical therapy, and I'm sure all of you have some in your local area. Weight management is a big one. We talked a little bit about that earlier, but maintaining a healthy weight can reduce stress on our weight-bearing joints like our knees and our hips. Exercise, that keeps the blood flowing, it keeps the joints moist. And low impact exercises, especially things like swimming and biking and walking, helps joint mobility, and it reduces the pain. It may hurt at first, so start out slow, but steady, and eventually you'll be able to go a little bit farther and you won't have as much pain. Trust me, that one works for me. Heat and cold therapy is always really a good one. You apply heat or cold packs to the affected joint, and that provides temporary relief. But heat can help relax the muscles and increase the blood flow. And cold therapy reduces inflammation. So we recommend that you use cold in the beginning, first 24 to 48 hours. And then after that, you can use warm packs, which feels better to me all the time than the cold ones. But cold packs really bring down the swelling, and it also brings down the inflammation. We can use braces and splints. Like when I had a tennis elbow from too much golfing, I think I wore one of those braces just below my elbow, and that really helped. So it keeps it immobile, but it's also important that you keep using your muscles too. And that's the other thing. If you have tight wrists, always make sure that you're exercising them and using them. Dietary changes, I talk a lot about that in my coaching sessions. Certain foods that are rich in omega-3 fatty acids like salmon and other different kinds of fish, antioxidants such as fruits and vegetables, and anti-inflammatory spices like turmeric and a whole lot of different spices can really help with inflammation and joint pain, and it really supports joint pain to begin with. So that's a really healthy thing to do. Supplements, again, I'm well educated in the supplements. We need to know what medication you're on, because a lot of times supplements don't play well with medications, but some people really find relief from joint pain, like glucosamine, chondroitin, as we said, turmeric. There's a lot of different supplements that we can recommend. And I work very closely with other certified functional nutritionists and also functional doctors. And so I have a plethora of people that I can turn to if you have questions about any supplements that you're on. Rest is especially important if it's a new injury. They talk about the RICE, so it's rest and ice, compression and elevation, and those are always important. Pain relief creams and topicals can help. Over-the-counter medication for some people, that CBD oil works well, and for others it doesn't. So you just have to kind of experiment. Acupuncture is wonderful. Massage is wonderful. I have some chronic back pain, and I have a massage at least once a month. Sometimes I treat myself to more than that, but that they can really move that, get those knots, I call them knots, just feeling really tight and tension in there, and I feel like a new person when I leave. Stress management is another one. Stress makes us get more tense, and it can really exacerbate the pain, and so I teach my clients breathing exercises, meditation. Yoga is wonderful for that. If it's really severe, you may need to get some injections, cortisol or hyaluronic acid injections can go right into the joint. That has to be determined between you and your doctor, because as a functional nutritionist, I do not diagnose and I do not prescribe medication. I am not allowed to prescribe medication, and I don't treat. What we do is we assess, we recommend lifestyle changes, vitamins, minerals, supplements, and dietary, especially dietary changes. And then we track that and monitor that. But we need to get to the root of what's going on, not just cover it up with pain medication. You can take NSAIDs or Tylenol or some of the other drugs, but that's just a temporary relief, and we don't really want to keep doing that. So again, it's essential to really work closely with the healthcare provider, especially if it's a severe injury or severe pain. I work with people to get to the underlying cause of their joint pain. And then what we do is we develop a comprehensive treatment plan. And we want to really address, like I said, the specific needs. And I really want to listen. And I do a great deal of assessing, asking a lot of questions, really checking, not judging, but we want to see what you're eating. We keep track of how you feel after you eat. I know that sugar really affects my joints. And that doesn't mean that I don't eat sugar, but I do pay for it the next day. And so I have to be very careful. I'm really trying hard to have some special occasions when I do that. But most of the time, if I can stay away from gluten and sugar, I feel so much better. And so it really is worth it. Talk to you soon.